Okay, so I'm going to begin with general survey. I see that the environment is clean. I see that there's no spills on the floor. I don't see any cords or hazards or anything that looks like there could be a harm to my patient or to myself. Also observing my patient, I see that her skin color looks normal for ethnicity. She's pink in color. She doesn't look to be cyanotic or pale. She looks to be calm. She looks to be breathing easily. She doesn't look like she's using accessory muscles to breathe, and I don't hear anything that tells me she's in any sort of distress. So I'm gonna go ahead and begin. So I'm going to knock on the door and come on in the room. Hi, good afternoon, Miss Maynard. How are you today?
I'm good, how are you?
I'm very well, thank you for asking. My name is Kristen and I'm a nursing student. I'm from Palm Beach Atlantic University, and they sent me in here today to assess your vital signs.
Great.
Is that all right with you?
Yes.
Okay, so I'm gonna close the door to provide some privacy and perform hand hygiene for your safety. And if you wouldn't mind, I'm gonna go ahead and check your ID bracelet just to make sure we have the right information. I have the right patient. Can you tell me your name?
Eliza Maynard,
And your date of birth?
9/12/04.
Okay, very good. Thank you, Miss Maynard. I have the same information. A couple more standard routine questions. Can you tell me where you are right now?
I am in the I'm in a nursing home.
Okay. And can you tell me what year it is?
It's 2025.
And what brings you in today?
I'm getting a checkup.
Okay. I have the same information. My patient was able to answer clearly and without hesitation, so she seems to be awake, alert, and oriented ×4. I didn't see an allergy bracelet, and there's no allergies recorded. Do you have any allergies I should be aware of?
No.
All right, and are you currently experiencing any pain?
No.
I'm thankful to hear that. All right, so I'm gonna start.
Okay.
Any questions?
No.
All right, we'll continue then. I have more questions. We're gonna do blood pressure.
Okay.
For blood pressure, I would like to know, have you had any caffeine?
No.
Have you exercised moderately or higher? Or had any nicotine or smoked in the last 30 minutes?
Nope.
Okay. And I'm gonna check out both of your arms. Have you ever had or undergone a mastectomy? That means breast tissue removal. So you've never had lymph nodes removed from either of your armpit area?
No.
And are you undergoing dialysis?
No.
Okay, so I don't see a fistula in either arm.
No.
I don't see any IVs. I don't see any swelling or bruising. I'm pretending this is skin.
Mhm.
Is there an arm that you would prefer that I use today?
No.
Okay, so we'll use your right arm since that's closer to me. I'm gonna check my patient's position. Her feet are flat on the floor. I'm gonna raise up the table a little bit so that her arm is about at heart level. And the next thing I'm gonna do is place the cuff on your arm. I'm gonna start by finding your brachial artery. That's there. I'm gonna go about 1 inch above that and wrap the cuff around your arm. And the cuff, as I'm doing that, sorry, I don't want to catch your hair, is a good size. It falls in the range there. That means this cuff is an appropriate size for her arm. And next I'm going to do something probably most nurses haven't done when they've come in your room to check your blood pressure. I'm going to estimate your systolic blood pressure. That's your top number. I'm going to do that by feeling for your radial pulse. And then I'm going to start to pump out the cuff, and I'm going to wait until that pulse disappears. Okay, it's gone, so like 118. So I'm now going to add 30 to that, so 148. That's where I'm going to pump up to, and then you'll feel the cuff get looser after I get to that point, and I'm going to be measuring your blood pressure. So just relax, we'll be done very soon. Okay, stethoscope on the brachial artery, pumping up to 148. Okay, Miss Maynard, your blood pressure today was 112/76. Is that normal for you?
Yes.
Okay, that does fall in the normal range of less than 120 over less than 80. The next thing I'm going to do is going to be your pulse oximetry and then your temperature. Have you had anything hot or cold to drink in the last 15 minutes or so?
No.
Okay, and do you have any pain in your mouth or any reason you wouldn't be comfortable with an oral temperature?
No.
All right, so go ahead and begin with a beep. Okay, go ahead and apply this under your mouth, underneath your tongue. Don't bite down, and then it takes a minute, so just bear with me. The thing will just kind of like it's thinking. And then, okay, your temperature is 98.6, which falls in the normal range of 96.8 to under 100.4. So we will continue. Next will be your pulse oximetry. Let's see if this works with that nail. Her hands are nice and warm. While I do that, I'm gonna get my watch ready. My watch that you're not supposed to have. There we go. Okay, so even with the nail polish there, it was 97. We'll go with that, 97%, which falls in the normal range of 95% or greater. Last for your pulse. Let me go ahead here and get to a timer. Okay, this will take a full minute. It feels like a long time when we're here in silence, so just bear with me. The more you're relaxed, the more of an accurate reading I'll get. I'm gonna go ahead and find for your pulse first. And then after that, I will go ahead and begin. Does feel long, doesn't it? All right, very good. So your respiratory rate was 14. That's 7 times 2, which falls in the normal range of 12 to 20 breaths per minute. And your pulse was 32 times 2, so 64 beats per minute, which falls in the normal range of 60 to 100. Are all of those findings normal for you?
Yes.
Okay. And is there anything else I can do for you, help you with anything before I go today?
I'm okay, thank you.
All right, thank you. You were a wonderful patient. All right, so questions.